the more teachers have an understanding of how to support and manage children, the better it is. So it's trying to look at psychological first aid. How can that be provided in the school setting? We often have little ones in the primary school age where they are named, they are labeled to be difficult or naughty. And again, I find those terms really difficult to understand, let alone accept. So it's trying to understand what the issues are, exploring issues when they are younger, trying to understand if there are any developmental concerns. Quite often children get brought saying there is a problem with the child, and what is so enjoyable about child psychiatry is that we have the opportunity, I don't know whether I can call it a luxury, of looking at systems around the child. So when we look at what is happening around the child from a point of view of family systems, education, societal aspects, we have an opportunity to think about the well-being of the child as a whole in the context of what is going on around them. And this is something that I'm really passionate about, which Dr. Venkatachalam mentioned in his talk. It's about taking care into the community rather than thinking about children coming in to hospital for treatment. How can we make sure that community-based care is also helped? And on a wider scale, how can we provide training on a wider scale so that people feel empowered? And stigma around mental health and stigma around emotional well-being is, it's a biased opinion, but I feel the more we get rid of it, the more easily people can access help. This is a vision, and I'm hoping that when we develop the team further and the department further, we'll have a whole multidisciplinary project where we can think about occupational therapists, social workers, physiotherapists who will be working very closely together as part of the team in order to think about the well-being of children who come into the hospital but also reaching out. And we know that long-term conditions are associated with significant emotional burden, and I'm not entirely sure that we explore that to the extent that it can benefit children and families. Quite often children as well as families tend to suffer in silence, and I'm hoping that we can together help change that. And it's trying to look at how we can do that in a thoughtful, meaningful way. And we are also thinking about teaching and training for our staff within the hospital as well, so they feel empowered. And we've been talking about compassionate leadership, what that means. So much for the opportunity.
Congratulations. I'm very proud to be part of this team. Of course, to Malti and the Shine team, they have 100,000 children which they look after, and I think it's 100,000 opportunities to do something more. Dr. Sri Lakshmi spoke about contributing to the society and the community, and I know that she's going to do a wonderful job with Apple. I'm not going to speak on Apple because I think you've heard everything, and you have Dr. Sri Lakshmi here, but really, we have 100,000 reasons to do so much more to society in Chennai. But why should we be restricted for Chennai? What I want this to become is a crucible of development of what we can do for children in India. We have 440 million reasons why this should succeed and why we should scale this program. So I request members of the press to really give it that focus, because there is so much we can do. I mean, we can change the lives of children. We can do it through telemedicine, we can do it through computers, we can do it physically, but we must do it. We must always remember that we are the ancestors to our children, and we actually borrow from their future. All of you would have heard of Greta Thunberg, and Malhania, and they won Nobel Prizes. 2 children winning Nobel Prizes for peace and working for the environment. If 2 children can do that here, this organization beyond the walls of Apollo Children's Hospitals, because nowhere else can you have this opportunity to do so much more for the future. We remember always that we are borrowing from the children's future, and therefore we have a duty to do so much more. I know we think we